Good morning to you and to all of those who tune in, and Dr. Gisela, who accompanies us every morning. We start our briefing today with good news, as we don't have fatalities to report from yesterday. Without abandoning any of the actions that we have adopted because the risks remain being very high. But nonetheless, it is good to report that as a result of the measures implemented and of the efforts of our people in general and our healthcare professionals who are applying treatments that save lives. We do have to report at present we have 7 patients reported in critical condition and 7 in serious condition, 2 serious cases more than yesterday. In our country, yesterday, 1,836 samples were studied to diagnose the presence of SARS-CoV-2 and the COVID-19 disease. At the laboratory of the Pedro Curie Tropical Medicine Institute, 872 samples were studied. In the Molecular Biology Laboratory of Havana, 281. In Villa Clara, 264. In Santiago de Cuba, 209. At the Brothers Almeiras Laboratory, 116. And at the Center for Genetic Engineering and Biotechnology, 94. For a total of 1,836. Of them, 1.7% tested positive. That is 30 samples. This number is lower than the one reported yesterday. At this moment, Cuba already accumulates 45,344 samples and 1,467 have tested positive. This represents the 3.2% of the processed samples. Of the 30 new cases confirmed, all were Cubans. 23, that is 76.6% of them, were contacts of confirmed cases, and 23.4%, that is 7, the source of the infection is being investigated. Of the 30 newly diagnosed cases, 19 are male, that is 63.3%, and 36.7%, that is 11 people, did not show any symptom of the disease. Regarding their distribution per provinces, 25, that is 83.3% of them are from the province of Havana. This has been going on for some time now, that the most cases are from the capital, followed by Matanzas with 3, Holguín and Santiago de Cuba with 1 case each. By age groups, the age group of those who tested positive is as follows. From 1 to 19 years of age, there were 5 cases. In the age group between 20 and 29 years, with 10, that is the 33.3%. From 40 to 59 years, there were 7. And from 60 years and more, there were 6. The largest number of cases is in the group ranging from 40 to over 60 years of age. Of the 1,467 patients diagnosed with COVID-19, 98.3% that are admitted to hospitals have a stable clinical evolution. And this is referring to those who are still hospitalized. Since the outbreak began, we grieved the cumulative loss of 58 people, which represents a lethality of 4%. We have the 2 evacuees that we always mention, and there are 617 people who tested positive who have been discharged from hospitals. This represents 43.8% of all the patients diagnosed on the island. Yesterday, 42 people were discharged. Today in Cuba, there are 11,525 visitors, 6,758 Cubans who reside abroad, and 4,767 are foreigners. In rental houses, there are no changes. A similar figure concentrated in the municipalities of Santiago de Cuba, Centro Habana, Plaza, and Playa. The number of patients admitted to hospitals, we now have 3,368. 54 patients are under surveillance, 2,224 are suspected cases, and 790 are confirmed cases. At the primary healthcare level, we have 6,839 under observation. Turning now to the international situation, the number of countries reporting transmission of the disease remain the same, with 183 countries. There is a total of 2,982,688 confirmed cases, 60,350 more than the day before. 210,193 fatalities, with 4,270 deaths in one day, for a lethality of 7.05%. In the region of the Americas, there is a confirmation of 1,215,105 confirmed cases, 32,672 more than yesterday. This accounts for 40.7% of the cumulative number of confirmed cases in the world. 67,869 fatalities, 2,117 deaths more than the day before, for a lethality of 5.58%. I would like to recall that in our country, according to the figure of confirmed cases that we have as of now, the provinces with the highest positive rate remain unchanged. The special municipality of the Isle of Youth ranks first with 46.4, Havana in second place with 29.6, Villa Clara with 24.3 per 100,000 inhabitants, followed by Ciego de Ávila with 18.7, Matanzas 15.2, Santi Espíritus 13.1, Mayabeque 11.7, Pinar del Río 8.6, Holguín 8.3, Artemisa 6, and Cienfuegos 5.3. The rest of the provinces have positive rates below 5. This is the situation regarding Cuba and the world. Grandma newspaper. Some experts speak of a silent hypoxia to refer to patients who did not report breathing problems, even though the chest x-rays showed advanced pneumonia. Can there be patients who, despite having a low level of oxygenation, are not aware of it? Yes. This has been identified in this disease, which has as a characteristic symptom a pneumonia that has been initially detected with a group of symptoms typical of pneumonia that are easy to detect because they are similarity to other pneumonias caused by other bacteria or by other viruses. But both in China and in other places, including the United States, specialists detected that there was a group of patients whose condition aggravated and even had a threat of dying, and yet did not have symptoms. From the respiratory point of view, to identify the disease. There are anecdotes of other patients admitted for other diseases, diabetes, fainting, accidents, that were studied and were confirmed to have the COVID-19. And yet, none of them presented respiratory difficulties characteristic of a pneumonia. And as of this moment, the disease began to be called the silent pneumonia. There were patients with low oxygen levels, and while talking with them, this situation was detected by devices for this control. However, they talked as if they did not feel anything. Now, how is this problem solved? Well, there is a medical device called the pulse oximeter, which we have in our country. And many people who have been in intensive care know how it works. It is a device that you put on your finger, and it measures the oxygen level that the person has. Now, already knowing that in the pneumonia caused by SARS-CoV-2 and by COVID-19 disease, in which low presence of oxygen can occur, then the patient is placed, receives the oximeter to identify this situation. This question is from Reuters. It is known that the Cuban health care system normally provides and implements vaccination campaigns and vector eradication at no cost. In the framework of the COVID-19 confrontation, medicines have been given to people, such as Prevengovir, free of charge. When else has the Cuban government given free medicines to the population in an emergency situation? Perhaps some of you are very young and do not remember, but I remember when the epidemic neuropathy, there was a free distribution of the medication Polivit that was manufactured at that time. In our country, all the medications required by the people who are admitted at the hospitals are free. We have the immunization program in our country that I have referred to many times here, which is totally free for all our population in all corners of the country. Referring to emergency situations, I remember when we had the cholera outbreak. At that time, there was a preventive medicine that protected against the cholera, which was also given to the population for free. Unlike this other one with COVID-19, there are some immunization processes that are being carried out to improve people's immunity, and so that if the person gets infected with the virus, his body will be able to respond in an efficient manner, and that all this applies to our entire population for free. On the other hand, we must recognize that the medicines that are sold in the country in the pharmacy network, when one compares them with the prices that they have in other parts of the world, one realizes that they are affordable for our population. They are cheaper than anywhere else in the world. That is what you buy. But for free, in an emergency situation, the ones that are necessary to improve the health and the quality of life of our population are available.